Could too much calcium cause heart disease? Getting the right amount of calcium is essential for strong bones and overall health. But could too much calcium increase your risk of heart disease? Years ago, a single study caused widespread concern and confusion. It prompted countless individuals across the U.S. to contact their doctors, worried about whether calcium supplements could be harmful to the heart. The concern stemmed from meta-analysis conducted by researchers in New Zealand. They reviewed 11 randomized controlled trials, the highest standard of medical research, comparing calcium supplements with placebos. These trials were originally designed to study the effects of calcium on osteoporosis and colon cancer, but they also included data on cardiovascular outcomes. The results, published in the BMJ, revealed that individuals taking calcium supplements experienced a slightly higher incidence of cardiovascular events, such as heart attacks and strokes, compared to those taking a placebo. Media headlines focused on a 30% increased risk, which understandably caused alarm. But looking at the actual numbers offers more perspective. 5.8% of people in the calcium group had a cardiovascular event, compared to 5.5% in the placebo group. So what does this mean? This study is just one piece of a much larger puzzle. It does not provide definitive evidence that calcium supplements cause heart disease, nor does it suggest an immediate need to change current medical practice. Some studies have linked calcium supplementation to increased cardiovascular risk, while others have not shown any association. What remains clear is this: getting calcium through food sources, such as dairy products, leafy greens, and fortified foods, is generally considered safer and more beneficial than relying solely on supplements. If you're considering calcium supplements, especially at high doses, it's important to consult your healthcare provider to weigh the potential risks and benefits based on your individual health profile. The connection between calcium and cardiovascular disease is biologically plausible. Calcium plays a known role in the formation of arterial plaque, the buildup that narrows and hardens the arteries. These deposits can also lead to arterial stiffness and may impair the function of heart valves. However, what remains unclear is whether elevated calcium levels in the bloodstream, such as those that can result from supplementation, directly contribute to cardiovascular events. One of the biggest unanswered questions is how much calcium the average adult truly needs to support optimal bone health without increasing potential cardiovascular risk. Recommendations vary significantly across health organizations. The World Health Organization suggests that as little as 400 to 500 milligrams of calcium per day may be sufficient to prevent osteoporosis. In contrast, U.S. guidelines recommend 1,000 milligrams daily for adults age 19 to 50 and 1,200 milligrams per day for those over 50. This wide range reflects the ongoing scientific uncertainty around calcium intake. Given this lack of consensus and the potential risks associated with excessive supplementation, many health professionals advise getting your calcium primarily from dietary sources. Foods naturally rich in calcium, such as low-fat dairy, leafy green vegetables, almonds, and fortified plant-based milks, not only provide this essential mineral, but also deliver other nutrients that support heart and bone health. Until more definitive evidence emerges, focusing on a balanced diet rather than high-dose calcium supplements remains the safest and most effective approach to maintaining bone strength and reducing the risk of osteoporosis, without raising concerns about heart health. Calcium alone isn't enough. While calcium is essential for building and maintaining strong bones, it shouldn't be your only focus. A holistic approach to bone health includes several other key factors. Regular weight-bearing exercise, such as walking, jogging, dancing, tennis, or resistance training, is one of the most effective strategies for strengthening bones and maintaining bone density as you age. Physical activity places controlled stress on the bones, stimulating them to grow stronger over time. Vitamin D also plays a critical role. It helps the body absorb calcium efficiently and supports overall bone and immune health. Safe sun exposure, about 10 to 15 minutes a day without sunscreen, is one way to meet your needs, along with dietary supplements. Most adults benefit from 800 to 1,000 IU of vitamin D daily, though individual requirements may vary. Don't overlook vitamin K, a nutrient found abundantly in leafy green vegetables like spinach, kale, and Swiss chard. Vitamin K helps regulate calcium in the body and is essential for proper bone mineralization. In summary, a comprehensive bone health strategy includes balanced nutrition, physical activity, and smart supplementation when needed. While calcium remains a cornerstone, over-reliance on supplements, especially in high doses, may come with risks, including the potential for cardiovascular concerns. Want more science-backed health insights like this? Subscribe to HeInfo, your all-in-one destination for trusted, expert-reviewed information on nutrition, wellness, and disease prevention. Don't forget to like, share, and hit the bell icon so you never miss a new video. Your health journey starts here with knowledge you can trust.